Next up is Dr. Jill Gaidos. So thank you so much, Dr. Gaidos, for coming. Dr. Gaidos is an associate professor of medicine, the vice chief of clinical research in the section of digestive diseases, and the medical director for the Yale Inflammatory Bowel Disease Program. Dr. Gaidos completed her medical school, internal medicine internship, and residency at the Virginia Commonwealth University, VCU in Richmond, and completed her GI fellowship training and the advanced postgraduate program in clinical investigation at the University of Florida in Gainesville. She was director of IBD at VCU, director of the GI clinics, and deputy chief of GI and hepatology at the Richmond VA before she moved to Yale. And really, Dr. Gaidos established a national program to provide comprehensive IBD care to veterans around the country. So very, very familiar with building a practice in that sense. Also well known through her work with the Crohn's and Colitis Foundation, ACG. She's given seminal lectures on IBD throughout the country and chaired educational meetings. So we're really delighted to have you here today, and thanks so much for coming.
Thank you so much. Thank you, everyone, for joining us and learning about this. This is a challenge for all of us. We've all gone through it. It makes sense to share what we know, so hopefully you don't make the same mistakes we did and learn from our process. So I'll be speaking about perspectives from leadership, what to understand on your search for your first or next job. I was specifically asked to throw in some information about negotiation, so I'll include some of that as well. So in my transition from fellowship to early career, I really knew that I wanted to work at an academic IBD center. I wanted to provide high quality care for very complex patients. And my goal was at some point to become the director of an IBD center. In that transition process, I interviewed at 3 medical centers. I really had a location in mind. I knew I wanted to get back to Richmond. I never did a second interview with any of them. So these are all bad things. So I never did a second interview. I essentially knew I wanted to go back to VCU. The chair called me and said, after my first interview, do you want to come back for a second interview, or should we just talk about the contract? So we moved on to the contract. He offered me a number, and I thought that sounded good. I did negotiate. So what he told me my career was going to be was to build up the IBD clinical practice, build up the IBD research program. So I did negotiate for 30% protected time for my first 3 years to build up the research program. He actually came back with the contract, and they offered me less money, and I still took it. And I was told that the contract, the rest of it was essentially non-negotiable. So everyone's nodding. This is what you hear in academics. It's not true always. After my first 3 years, my career was not going where I wanted it to. I actually didn't have a huge IBD panel. I worked with the fellows probably a half day a week, and really essentially felt like this was what I imagined private practice to be. I was not subspecialized. I wasn't teaching. I had gotten a research grant that didn't buy me any protected time, and it didn't buy me a study coordinator. So I was also becoming the study coordinator for that research study. So I was actually approached about developing an IBD program at our VA. And so I transitioned from the academic center to the VA medical center to build an IBD program. So with that opportunity, I actually started the first dedicated IBD clinic in our VA medical center in Richmond. I created a national VA IBD scan echo conference similar to what was already created for hepatology. That's still going on Wednesdays. Dr. Meena Prasad has taken it over. I also had the opportunity to join the National VA Faculty Advisory Board. Initially, they had an IBD task force, and then it became a subcommittee, and now I believe it's its own separate committee, but helping to really oversee the management of IBD across the VAs nationally. I took over our IBD clinical trials program. Again, this is exactly what I wanted to do. I also got some additional grant funding for IBD research. I joined the Crohn's and Colitis Foundation, their professional education committee, which allowed me to work on some health maintenance guidelines, to develop webinars, to do some of the education that I really had been missing out on. I also, again, saw some other opportunities for growth and to try new things. I became the associate program director and the VA site director for our GI fellowship, which gave me an opportunity to implement some changes in the GI fellow rotations at the VA, some pain points that they had been complaining about, and really was easy fixes. And so I took it upon myself to step in and take that over. I also created a research program for fellows with more dedicated meeting times and helping with research mentorship so that the fellows could find a research mentor in an area of their interest, and became the chair for the clinical competency committee. I also, again, saw an opportunity to help fix some of the pain points within our GI clinics and became the director of the GI clinics. I oversaw all the schedules for all of the GI clinics, not just the IBD clinic. So scheduling the template, improving access to our GI clinics for the veterans, and with sort of all my hands in all of those pots, became the deputy chief for the section of gastroenterology. I also really started working on building a national reputation. We've talked about sort of the career pathways in academics, and one of the things that you need is you need a national reputation in order to go up for promotion from assistant to associate, associate to full professor. And one of the ways I did that was becoming an active member of the ACG Women GI Committee, and eventually became the chair of the committee in 2014. Worked on the Professional Education Committee for Crohn's and Colitis Foundation. I was on the Richmond Regional Board for Crohn's and Colitis Foundation, and then also Crohn's and Colitis Foundation's Women in IBD Task Force. And then, like I mentioned, the National VA Faculty Advisory Board. So getting to mid-career, so 2016, I was promoted to associate professor just with all the things that I had been doing. I spent 6 years at the VA and was actually in line to become the chief of the section. In 2019, I got an email from a recruiter asking about the medical director of IBD position. And it sort of took the wind out of me. It made me pause. And I thought about where I was going and what I was doing. And I really had to rethink my goals and my career path. Was I ready at that point in my career to become the chief of the GI section of the VA Medical Center? Did that meet with my expectations for myself? I don't know if you've heard this quote before, but it really hit home. If the ladder's not leaning against the right wall, every step we take is getting us to the wrong place faster. So that's where I felt I was. I was right on track to get to the wrong place for that time. In my mind, that wasn't what I saw as success. We all sort of have our own definition of what our career success is. And maybe in 10 or 15 years, I will want to be the section chief at a VA medical center. But right then, I really had to reassess what I was doing. So I thought about it, and I still really wanted to work in an academic IBD center, providing high quality care for complex patients. And I still really wanted to be the director of an IBD center. So at that point, I actually reached out to 8 different academic IBD centers and interviewed at 6 of them. So this was all me contacting people I know, saying, hey, do you have a position? Are you looking for anybody? I looked for a position where there was potential to be promoted to a director. So not necessarily right away if it wasn't available, but probably within the next couple of years. I wanted a position where my experience, everything that I have already done, would be valued and utilized. And I wanted a position that matched my career goals. I wasn't going to look for a 50% or 75% grant funded research position. That's not who I am. I'm a clinical gastroenterologist. I love to do clinical trials. I do investigator-initiated studies, but I'm, predominantly clinical, and I wanted something that fit. This time around, I actually negotiated a lot for salary. I used Doximity to find regional median salaries for the area to justify what I was asking for. I negotiated for protected time. I negotiated for startup funds for research. I actually met with other IBD doctors and said, this is what I'm asking for. What am I missing? What else should I think about? What else should I throw in there before I sort of, finalize this deal? My position already included, so why I didn't negotiate for this, because I was already getting a study coordinator was already rolled in. We had admin support. I have a IBD nurse coordinator, and then we have somebody overseeing the prior authorization. So that was already in place when I got here. So it didn't need to negotiate for that, but absolutely would have if it weren't available. So things to think about, we've sort of already covered this, but again, just make sure that your career goals align with what they're looking for in the position, the current practice, the section leadership. So when I was leaving, I actually found out that I had been promised to build up our IBD research and to build up the IBD practice. And when I left, I found out that the chair of medicine really just wanted a clinic. And so the goals didn't really align with my chair and his boss. So those are things that you can ask. You will meet with the chair of medicine. You can say, hey, what are your expected objectives for this position? And then think about your potential and where you think you want to go. If you want to be the director of an IBD program, make sure that position may be available in the next 5 or 10 years, or at least you will get experience with the various aspects that you'll need to be an IBD director, like clinical trials and starting programs and growing. And then 2, if you want to be a grant-funded IBD researcher, it's really important to make sure they have the infrastructure and the support for the research. If that's what you want to do and they're asking you to be 70 or 80% clinical, you're not going to be able to build up your research in that framework. Make sure you have adequate support. We've talked about some of the things that you need for IBD. Look for opportunities for ongoing career development. If you want to be the program director for the fellowship program, ask for an associate program director position. So stepping stones to get to where you need to be. It's okay to ask the tough questions. I've been asked about maternity leave. I have a 13-year-old and 11-year-old, so I haven't had to get maternity leave at Yale, but I can direct people to some of our junior faculty who have had kids recently. Again, talking about pay schedule, call coverage, where you live, what are the schools like? Those are all very important things, particularly if you have a family. And then spend time with the people you're going to work with most. I went out to dinner several times with the IBD team. These are the people you're going to spend a lot of time with and work with. So make sure you actually like them. So what did I learn through this process? Your first job is unlikely to be your only job, and that is okay. That's really just how medicine works these days. You sometimes have to move around to move up or to switch gears, to pivot. Look for opportunities for continued growth and advancement. It's good to take on different tasks, learn from those experiences. I learned I have no desire to be the fellowship program director. That doesn't meet with my core goals in life. I really enjoy teaching fellows, but I don't want to be the one responsible. Take on different tasks, learn from those experiences, reassess your goals every few years, pause. Ask yourself, am I heading in the right direction? Is my ladder leaning against the right wall? There's really no right way to do this. You have to figure out what works for you and what makes you happy. We talked about burnout, how burnout can cause you to change locations, change positions. There's a study that shows that you need 20% of your work week has to be something you love. That's it. So figure out what you love and make sure you're continuing to do that. And only you can define what is success for you. That's everything for me.